Okay. So just to practice the polling feature, you should see a poll in the bottom right-hand portion of your screen. And if you could select an answer. Okay. If everyone could select an answer. Okay. I'm going to close the poll. Okay. So 2 of you will be teaching an IT course. 1 of you, I'm assuming, is either a allied health or nursing instructor. You'll be teaching infused health IT content. And none of you will be teaching health IT content as part of an IT course. So I am intrigued with the 6 of you who answered other. Let's see, those of you who answered other, can you unmute your mics? And let us know what the other is.
This is Amy, and I'm teaching as part of the Infusion program, or Infusion courses into my Health Information Management program.
Okay. Thanks. And
You're
who
welcome.
else?
Hey, this is Bill, Margaret. I think I might have misvoted on this because I got hasty. I'm going to be doing a KHIMS prep course, which I don't think qualifies as a class, actually.
Oh, okay.
So that needs to be part of, I don't know, allied health possibly or something. I don't know, or other.
It does qualify as a HIT course.
Does it?
Yes, it does.
Good, I feel better already.
All right, anyone else who chose other?
Hi, Margaret. This is Vivian. I chose other because I'm developing the courses but not teaching them.
Okay, and you're working on CA HIMSS content at the moment as well, right?
Yes, I am.
Great. Anyone else? Okay, so let's run through a few of the other features. The chat box. If you could go to your chat box and enter what you hope to get out of the faculty health IT training program. So be sure your send to box has everyone selected. So the question again is what you hope to get out of the health IT faculty training program. Bill, a new job. Okay. Oh, Lynette, I am talking, but no one can hear me.
Nobody's doing what?
Lynette said that she's talking, but no one can hear her.
Yeah, I don't hear anybody but you.
Really?
Yeah.
So you haven't heard anyone else speaking?
I think I heard, I want to say it was, I think it was Brooke at one time, but that's been a while.
Is that the case with everyone?
Margaret, I can hear Amy and Bill. I couldn't hear Lynette and whoever spoke to you about teaching CA HIMSS after Bill. I couldn't hear.
Oh, and then all of you, but that's it.
Oh, this is bad. Okay. Sounds like WebEx is having some kind of difficulty with their audio.
Yeah, something's going on.
Yeah.
So have everybody raise their hand that can hear you, I guess, and
yeah,
maybe see if they can hear me and Brooke. 'cause I don't hear anybody.
So if you just heard Bill Sanderson speak, can you raise your hand?
Yeah, I don't think they hear us.
Ken, are you able?
People calling in might not be able to raise their hand, or can they?
Yeah.
They can. Huh. I don't know whether we should reschedule or what, because this is designed. It's designed to be extremely interactive. Well, maybe we can just heavily use the chat box. If you can hear me, please raise your hand if you can hear me speaking. Okay, just about everyone is able to hear me. Ken, are you able to hear me?
Yeah, I don't hear anybody but you and Brooke.
Everything by
and I don't
chat.
see anybody in their hand either, so.
Just about everyone. Okay, Ken was the only one who couldn't hear me. He's just not able to raise his hand. Okay, well we're gonna forge on ahead, and we're gonna have to use the chat box heavily. So if you're having any problem with the chat box, let me know. Okay. So my question in the chat box before the big distraction of weird audio issues, what do you hope to get out of the faculty health IT training? The online, primarily the online, and the webinar as well. I know that in some cases people may have been pressed into service, but I'm hoping in other cases it was a genuine interest. Okay, tools to pass on to faculty. And Lisa asked, can you exit and come back in? Yes, Lisa, no problem. Explore ways in which Bellevue College can partner to create health IT classes. Great. And Chris, ideas to use to incorporate into my courses. Excellent. And Ken, training that'll help you become a better instructor for the health IT infused parts of your program. Yes. Okay. And we've already practiced the hands up function, so we can cross that one out. And shout out, if you could all unmute your mics and just shout out what you had for breakfast this morning.
Something sweet and kind of cereal-y.
And everyone can yell at the same time. It's no problem.
Cereal.
Cereal.
Okay. Hopefully everyone knows how to mute and unmute their mics. Okay. And we tried out polls, so let's move on. Okay. There's me, and there's Brooke. And we'd like to do introductions so that you all can get to know each other as well. So if you could type into the chat box your full name, the college that you're with, your academic expertise, and one aspect of health IT that you find interesting. And P.S. Lynette had yogurt for breakfast. So Lynette, you muted and unmuted and nothing happened. Lynette, I'm not seeing a microphone next to your name. Did you call in? Of course, you can't tell me. Yes, you had to call in. You need to unmute next to your call-in username. But which one are you? I don't know. And Billy, yes, you're answering this via chat. Okay, Michelle does curriculum development, third grant. Chris, our East Coast representative from Northern Virginia College. Oh, health information exchanges. Yeah, when that really gets going, when we truly have connectivity all across the country, that'll be fantastic.
Yes, I'm looking forward to that.
Yes. And Amy, health information management. You find all of it interesting. Fantastic. Scott from Spokane Community College. Network engineering and mobile devices. So network engineering is your specialty and mobile devices is the aspect you find most interesting. And Ken, hemodialysis instructor. I found it fascinating to visit your college, and I had never seen a hemodialysis machine before. And to see all the students practicing and to see what a machine looked like firsthand. Amy Kinchella, Renton Technical College, and medical assisting instructor. Yes, big need for medical assisting students and nursing students to get exposure to health IT. Health IT is the future and the present, yes. And Vivian with Bellingham and Watcom, curriculum development for health IT. Vivian, any particular area you find interesting in health IT? Unfortunately, you're going to have to type it in since we have these audio issues. Vivian, you have your hand raised. Vivian likes it all. Okay. Bill Sanderson, you're a computer network technology instructor, and you're interested in the new converging roles of IT and healthcare. And yes, the career opportunities they open up for students. It's a really promising area. Oh, and the increasing use of big data. Yeah, fascinating what we'll be able to do. Can you imagine if we can aggregate data on 1 million patients with a particular, let's say diabetes, and through data analysis, analyze which treatments worked the best? That's pretty powerful. Lynette, currently the project manager, but I have taught and written curriculum. Oh, interesting. Interested in everything, but you know that your CNET group is interested in seeing the guts of EMRs. Yeah. And Amy, also a graduate from NOVA. Oh, nice. A small world. Vivian says health IT is fun. Lisa Harris from Bellevue College. And Lisa, what is your IT specialty? I know you're interested in data integration. No. And Lisa, you'll have to type in because if you're speaking, we can't hear you. Okay, well, thank you all. So learning objectives for today's session are, I just have a very few slides about the grant itself. I know that some of you, like Lynette, are very conversant with our grant, and others not so much. So just a little bit of information on that. And a look at some of the key factors driving the increased need for health IT skills. And then we'll spend the bulk of our time exploring health IT instructional resources, evaluating the resources to see what features of the different activities work well, what don't work as well, and then sometime discussing health IT interests. So a little bit about the grant. A little over a year ago, we were awarded $11.8 million to form a consortium that includes 9 colleges, 8 of which are in Washington State and 1 in Virginia. And we also have 5 contracted partners. And the primary focus of the grant is to expand health IT workforce development capacity, not only in the colleges that are participating in the grant, but nationally as well. And then the other significant focus is to train and assist into employment, into health IT employment, veterans and others. Some other aspects of the grant include the development and national dissemination of curriculum and faculty development. Health IT obviously straddles 2 specialties. There's a health component, there's an IT component, and in most of our colleges, these 2 areas are pretty siloed. So giving IT faculty a chance to learn more about healthcare and giving healthcare faculty a chance to learn more about IT and healthcare is one of the goals of this grant as well. Mentioned a focus on veterans. We saw health IT as an excellent career option for veterans. Veterans coming back from military service who are technologically adept, and many of whom have healthcare experience in the military or IT experience in the military. So to be able to help them parlay those skills into a civilian career in health IT is a focus. And HIMSS, which is one of the larger health information technology professional associations in the world, is our partner in this grant. And we have a staff person located at HIMSS who will focus on basically laying out a welcome mat for veterans who are interested in health IT careers. Next year, we'll also be launching the first ever federally registered health IT apprenticeship. EMR Star. Bellevue College has been involved in health IT training for the last decade, and one significant and persistent obstacle that we've found is getting hands-on access for students to actual EMR systems. There are some options out there. A couple of vendors have provided academic access, but it is extremely expensive typically, and it's typically just a simulation, so not an actual live system. So EMR Star will have ultimately 5 or more different EMR systems available to students. We have one available right now called OpenEMR. It's an open source practice management outpatient system. And beginning in January, we're adding a second system. It's also open source, Vista CPRS, and that has more of an inpatient focus and is a more complex system. Health IT credit for prior learning is another emphasis in the grant. This is particularly relevant for veterans who should be able to get credit for training that they've received in the military or professional experience that they've had that's relevant. Here are the 9 colleges in the grant. Consortium, many of which are represented here today. As I mentioned, HIMSS is a partner, and also CHIRP. CHIRP is the group that is setting up EMR Star. Okay, a quick look at some of the factors that are driving the demand for health IT skills. So, patient safety, huge concern. For obvious moral reasons, patient safety should be a big focus in healthcare organizations, but there are other reasons as well. Accreditation by various healthcare bodies, reputation, and financial concerns. It's expensive to be sued. So safety is a big area of focus. Quality and quality improvement. Again, there are moral reasons and accreditation reasons. Health IT is instrumental in both of these things, in safety and in quality. It is virtually impossible with the amount of information and the amount of research that goes on currently in the world. It's impossible for a provider to keep up on everything. So providers need access to information, to evidence-based medical information that they can access at the point of care, and health IT can provide that type of access. Also, in looking from an organizational perspective on how an organization is doing in terms of healthcare quality, they can analyze data collected with health information technology tools to see what areas need improvement. Access is another big area, and one example of how health IT can be instrumental in that is a lot of rural patients have, or in rural areas, there is a significant shortage of primary care physicians. So telehealth is being used increasingly to provide access to both primary care and specialist care to individuals located rurally. And finally, cost. The cost of, no news to any of you in this session that our healthcare costs are really out of control. Health IT can help in various ways control costs. For example, if there is coordinated care with shared patient records across facilities, we won't be duplicating tests. I don't know if any of you have dealt with sick family members or elderly family members who go to a host of different providers, and every single one you have to tote around records of the person's medications, what tests they've had done, etc. It'll be fantastic when everyone is connected. Any comments on any of that? Okay.
It's very interesting to look at the price difference for the hospital beds and stuff versus the U.S. versus Australia.
Isn't it astounding?
Yeah. No, it's crazy.
Yeah. A couple of other things that are coming down the pike in healthcare. One is accountable care. Right now, our healthcare system works on a fee-for-service basis. If the more services a provider gives, the higher his or her revenue. So the government is looking at initiatives to shift that model to payment for favorable outcomes. As you can imagine, this is incredibly complicated. But at any rate, tracking for this sort of thing requires health information technology. Another concept is medical home. This is an approach to primary care whereby one primary physician works with a team of people, so a team of medical providers who can then coordinate the care and have a comprehensive integrated approach to the patient. instead of a patient going to one person and going to another provider and not having communication among the providers. And being able to share patient records would be an integral part of being able to implement this type of approach. And finally, one of the biggest drivers is a piece of legislation called the HITECH Act. And the Office of the National Coordinator for Health Information Technology created the details of this legislation. Essentially, there is a carrot and a stick. Providers and hospitals can receive pretty hefty financial bonuses if they implement EHRs by a certain date and use them in a meaningful way. So using them in a meaningful way is more complicated than I'd like to get into today. I don't want to bore the living daylights out of you. However, in the online self-paced materials, there is a section on meaningful use. So if a provider meets the criteria, that provider can receive a bonus. And just to give you an idea, a typical bonus is about $44,000 per provider. If, however, they do not implement an EHR system by 2016, then the stick comes into play and they receive reduced Medicaid and Medicare reimbursement payments. And Amy, I know you've been swimming around in this for a long time and probably have a lot more expertise than I do. So if you'd like to chime in on any of this at any point, unfortunately, you'll have to do it by chat box. So,
okay.
Yeah, because I think I might be one of the few people who can hear you. So there has been an implementation frenzy over the last few years in terms of EHR implementation, which in turn is driving the demand for people with health IT skills. Also, those of you who are in the health field, I'm sure that you have started to hear employers clamoring for students who have had exposure to health IT and have gotten their hands on an electronic health record system because the employers don't want to start from ground zero. They expect students to come out with some exposure. So I thought you might find this interesting. Burning Glass Technologies, they did a study of demand from 2007 to 2011. 36% health informatics jobs increased from 2007 to 2011. That's pretty significant. And Chime is a group of healthcare CIOs, and in a survey last year, 67% said that they were experiencing shortages. So it bodes well for employment prospects for our students. I took a stroll through Indeed.com, which I'm sure most of you know is an aggregator of job listings, and I found close to 5,000. I just typed in health information technology and looked at what came up. Almost 5,000 jobs in Virginia, similar in Washington, and almost 1,000 of those were new listings. The job titles are all over the place. I know people are a little confused sometimes when we first start talking about health IT and they say, well, what is health IT? And it's not any one thing, all over the map. I was curious to see genomics SME. The whole mapping of human DNA is adding another dimension that health IT will be able to take full advantage of, being able to personalize medicine based on a person's genetic profile. That is pretty amazing. And I think we'll see more of that now that genetic testing is down to about $99 a person. So we can look for drug companies testing medications with different genetic profiles and seeing what's most effective for different types of people. Okay, so let's shift gears, unless anyone has any comments on that. And feel free to keep a running dialogue. So I have a question for you before we start, and I'm going to share a poll. Okay, there was a study done that was a pretty well-known study. And they looked at they studied college students listening to lectures. What % was paying attention at any given moment on average in a lecture? And I think some of you are familiar with this study. Okay. So 4 of you said 5%. It was bad. It was low. The number was, but wasn't quite that bad. It was actually 20% were paying attention at any given moment. I will add that when I came across this, my main mode of instruction was, it was about 90% a lecture at the time. Really kind of shifted things for me. So what does my sharing this poll accomplish? Why do you think I shared it? To what purpose? If you could chat in the chat box. Anyone want to chat in the chat box? Okay, to remind you to pay attention. Yeah, increased engagement. Yep, okay, and Amy, yes, aware that different modes of instruction learning are necessary. All of the above. Yep, and Vivian, to point out that it's important to have multiple activities. Yes. Michelle, a test to see how many people were listening. Okay, and Ariana, different people learn in different ways. Okay, so what we did, we had another grant prior to this one, and we trained 1,000 people at the VA in health IT. And what we put what we called hook questions. These were ungraded assessments at the beginning of each module because it made it more fun. And there are several other reasons also, but let me show you a couple. I'll give you a minute to read. Okay, so what would this achieve? This was, as you might guess, it was on introducing a module on workflow process, workflow process analysis and process redesign. It's kind of a mouthful. So what would this achieve? It's ungraded. Okay, yeah. Brooke, exactly. It highlights the importance of the subject matter in this case. So it's kind of an adult learning principle is that if you can show why it's relevant and what's in it for me, what are the benefits of learning this? So we have a whole series of these hooks. We have a set of about 30 of them. And Lisa, pointing out how effective it is using a question. Yeah, it's a different way into the topic besides just immediately starting with a lecture. If you have seen CNN polls or for the ladies in the group, Cosmo quizzes. So people like to test themselves. It's like a little puzzle. Okay, here's another one. So if you have a mixed group, mixed in terms of IT and health faculty, which we did in the VA, some of the IT people thought, oh, I don't need to know about workflow. So this was an attempt to show, hey, everyone is part of a workflow, and it points to the relevance of the material. So we referred to these as hooks, just kind of a more interesting path into the material to pique curiosity, show relevance, demonstrate importance, that kind of thing. And happy to share all of those with anyone who is interested. Okay, I'm going to pass the controls over to Brooke. And also, as I mentioned, feel free to have a running dialogue here in the chat box.
Thank you, Margaret. Okay, so some of you mentioned that you wanted to get more instructional materials for your classes, particularly in health IT. And I really am excited to be in this room with both health faculty and IT faculty, because I think it's a conversation that needs to happen, and it's great that you all can be in one course together and share ideas. So I hope by sharing some of the resources that we've developed in this grant, and by we, I mean some of you in the room right now, we hope that we continue the dialogue and start to share more resources with each other throughout the course. But to begin, I just want you all to think about classes that you've taught and what else in your classes besides lecturing do you guys use to engage your students? So just type into your chat box anything you've used that has engaged your students. Discussion forums, great. So good discussion questions. Labs, hands-on labs. Yeah, students like to really do things. Games, great, Ariana. Wow, they're all coming in faster than I can read them. Peer reviews, okay, so getting students to teach each other. Student introductions, that's interesting. Chris, would you mind probably not unmuting your mic because I don't know if everyone can hear you, but would you mind typing into the chat box what you mean by that? And Ken, you ask your students to write a question at the beginning of the lecture that they want to have answered. That's a great motivator for them to listen to either the lecture or the activity or the course and see if their question can be answered. Amy, hands-on puzzles, competitions. Everyone loves a good competition. I'm extremely competitive, my family will tell you. Okay, and Chris, if anytime here we are. At the beginning of each course that I teach, I require each student to introduce himself and respond to at least 2 other students. Okay, so kind of encouraging student interaction. And I think that also goes back to the peer review, allowing students an opportunity to interact with each other and learn from each other, not just from the teacher. Great. These are all great ideas, and we're going to go through some of these ideas in the field of health IT and potentially explore other ones together. So just to take a quick look at how we do engage learners, and you guys have already brought up most of these, if not all of these. Provide tasks that they can do, okay? Promote learn by doing, so in labs you mentioned. Give them opportunities to apply their skills. Provide varied input, so you guys talked about different games or hands-on activities. Providing feedback, and you can do that in the form of peer feedback, as you mentioned. You can also do that in the form of instructor-led feedback. Yeah, so all of these really engage learners beyond just giving the same old lecture. Not that lecturing is bad all the time. It's useful sometimes. So we're going to look at some activities that have been developed on this grant. One in particular was on the previous grant. And I just want you to go through the activity with me and then type in your chat box why you think this activity would be engaging for students. So I'm going to share with you my web browser. Okay, so here is the EMR simulation activity that we used for students to just get an experience of what it would be like to access the patient summary screen of an EMR. And this is actually from EMR Star that Margaret mentioned. Is available for students to interact with and kind of experience both the front end and the back end of an EMR system. So the students go through a video just pointing to the different parts of the EMR. You all can't hear the audio right now, unfortunately, but it's screaming in my ear. But going through the different aspects of the EMR, and then the student is given kind of a scenario or simulated environment. So I'll give you all a minute to read that. Okay, so then we go to like a challenge or a question and click on the question. Anybody know the answer to this? Where in the EMR patient summary screen would I be able to find out if the patient is going to have an adverse reaction to this medication? If you know the answer, just type in your chat box. So then the student just kind of goes through, maybe they think it would be, oh yeah?
Can I interrupt for 1 second? To access your chat box, you'll need to go up to the very top middle of your screen and click once on chat and once on participant so you can continue to view those panes. Okay, sorry, Brooke.
Yeah, no, thank you. I appreciate that. Okay, so so everyone should see their chat box kind of as I do. Maybe you can't see it on my screen yet, but so as students get the question, then they need to go through the EMR and try to figure out where they would find this information. And yeah, Chris and Ken, they're wondering if it would be under allergies. So if we click on allergies, yep, correct. Allergies and adverse reactions are noted here. And then the student continue on to the next question. Okay, and we won't go through the whole thing, but I just wanted you to give you an idea of what the student might be experiencing in this activity. So just type into your chat box why you think this might be engaging for a learner. Great, it's visual, it's hands-on, so it's providing multiple media for them to learn through, not just one oral method as in a lecture or even a visual method as in a reading. It's real world. Okay, yeah, so it's actually problems that they might encounter in their work environment. And students have to do it for themselves, as opposed to just listening about it. So again, we go back to learning by doing. Great, Chris. It helps them actually apply what they've learned in real life situations. That's very important, especially for adult learners. And yeah, it gives, I think what's great about this, and more so than this, EMR Star, is that it actually gives students a real experience to an actual EMR system. This isn't a simulated EMR, it's a real EMR. And I think that's invaluable for students before they enter the workforce. Excellent. We're going to look at another activity. This is more an activity geared to those of you infusing health IT content into a health program. And this is an activity, Bill, I think you've probably seen this before when you piloted your program earlier this summer, but this is an activity that's geared more towards infusing health IT content into, oh, sorry, this is actually also for health. This is for a medical assisting program. For those of you who don't know what SQL or SQL is, Bill, would you mind just typing into your chat box, or actually Scott, any IT faculty out there, quick definition of SQL for other health faculty? Okay, thank you, Scott. Microsoft Database Program, okay? And I believe, and correct me if I'm wrong, it stands for Structured Query Language. So it's I guess, a way of entering data into a relational database. So what we have here is another activity developed, and I'll give you a moment to read it through. And then I want you to think about why this activity would be engaging for students. Thank you, Lisa. SQL is a code you write to query the database so that you can pull out a report. Great. Allows you to query the database and obtain certain data elements. Excellent. Thank you. So why would this activity be engaging for students? It requires them to think. Okay, so they actually have to process the information and create a SQL query from the information. It's not just actually retrieving information from a lecture and then spitting it out in terms of a multiple choice question. Helps them apply, okay? It asks them to take this information and actually create a query. Model something they would likely do. So again, mimicking the actual work environment. Okay, and it's hands-on, and the success would be gratifying. Great. Okay, we're going to take another look at an activity that, Vivian, you actually drew my attention to this activity, and I just can't get enough for it. Yeah, Vivian, this was for a medical assisting class at Renton Technical College. They infused that piece. This is an online gaming activity, and students go in and have their own practice, and then they're posed a bunch of questions around HIPAA. And actually, I'm going to ask the health faculty right now if they can just quickly write in a definition or explain to the IT faculty what HIPAA is. And Lisa, I can get you the course name and number for Renton, or Bill probably knows it as well, but I can pass that along to you after the webinar. Thanks, Ken. Privacy rules, confidentiality of patients' information. Yep, Amy, privacy and security rules and regulations that healthcare providers must follow, regardless of it being health IT or IT related, if it's digitized health patient information or not. So this game, students are introduced to a variety of scenarios, like this one, for example. And then they're posed a question, such as this one, and then they're asked to make a decision. Okay, and they need to choose the correct decision, and then they're told if they are in compliance with HIPAA or if they are not in compliance with HIPAA. So why would a game like this be engaging for students? Yeah, it's a lot of fun. Great, critical thinking, okay? It's not just, again, listen and regurgitate. They actually are applying the knowledge again. It's also, some of you mentioned that using competitions in your classrooms. This game actually, you accrue points by the end, so you have a score. So you can actually have students compete against each other within the same classroom. Yes, it's very visual. It actually looks like a very nice clinic that you might work in, and very organized clinic that you might work in. Yeah, very good, Lisa. It shows not all the responses. It's not obvious which one is correct. All of the choices that you have could be potential choices that someone might take. So it actually requires the student to really hash out the differences between each and select the best one. Okay, great. And all these resources are included at the end of the presentation on the resources slide, if you guys want to use them. Yeah, and Amy, it's more memorable, definitely, than listening to a lecture. Okay, this is the final one that they are actually using at Pierce College, and it's for infusing health IT into a healthcare database management and design program. And what I love about this scenario is that they introduce it in one of the first courses of the program, and the students work with this database that they're creating in this Our Hospital scenario throughout the entire course, and then it carries over into other courses within the program, so throughout the entire program. So they are constantly building upon this database. This is just the scenario part. It's not the entire activity. But just to give you a taste of the kinds of activities people in IT programs are developing for infusing health IT into their programs. So looking at something like this, why would this be engaging, particularly engaging for students?
Brooke, are you talking? Because if you are, I can't hear you.
Okay, can you all hear me now?
I can hear you now.
Great. Good, we got a few yeses coming in. Maybe I'll chat and make sure. Bill, did you drop off a while back, or have you been just recently?
Brooke, Bill had typed that in before you dialed in.
Oh, okay.
Uh-oh, Amy still can't hear you.
Not yet. Okay, maybe I'll keep talking. Amy, can you hear me now? Looks like some people are getting dropped off and they're trying to reconnect. So Margaret's suggesting that everybody use the teleconference line. She's posted the toll-free number and the non-toll-free number into the chat box. So we'll wait a little minute to make sure everybody's reconnected. Apologies for all these technical difficulties. This is actually the first time we've had so many.
I thought it was something to do with our phone lines here at our college because we've been having issues with it. It kicked me off, and then you were talking, I logged back in, but I still couldn't hear you.
Well, it actually before I logged out, it kicked me off too. So I think it's a WebEx thing.
Yeah, it looks like a lot of them aren't. Like Amy.
Yeah, a lot of people are getting kicked off.
Yeah, Bill.
Yeah.
Yeah, I think everybody got kicked off actually.
Hi, this is Chris.
Hi, Chris.
Hi there.
Oh, good. We can hear you. You can hear me. We're good.
Yeah, that's good news. Am I the first one to join?
No.
No, we got a few on the line, but it seems everyone got kicked off, so we're just trying to get everybody back on again. Thanks for coming back.
I'm off the phone.
This is one of the
who?
Vivian. I'm
Hi, Vivian. Welcome back.
Hi, Vivian. Wow, I'm so sorry about this. We use WebEx all the time, and it usually goes so smoothly. This is unusual that we've have glitches like this. But thank you for being so patient.
It's ironic how it's an IT thing that's an IT thing.
Of course, it would be the one day when we're having a faculty development webinar.
Well, we're definitely no IT experts over here, so. I'm just going to do a quick shout out just to see who's on and if you can hear me. So if you can hear me, just reply yes or smiley face, something in the chat box so we can do a quick head count. Okay, we got Amy, Lynette, Chris, Scott, Margaret, Ariane, Michelle, Ken, Lisa, Bill, you're there, yeah? Bill and Vivian. Vivian's there.
I think Bill is logging off and trying to log in again because I don't see his name anymore in the session.
Okay. Okay. Well, we're going to move on, and hopefully Bill will join us in a minute here. Before this lovely break, I asked you all to think about what makes a good discussion question. So if you can just type into your chat box your response, that'd be great. Yeah, more than one correct answer. It has to be something that actually generates discussion and doesn't provide an answer and then stop dead in the air. Good, an open-ended question. Yes, a response other than yes or no. A political topic, definitely. Well, that would be a fighting question in my family, but Yeah, that would be a good discussion question. Yeah, something that asks for people's opinion and perspectives. Everybody's opinion's unique, so that would always generate different responses. Great, something that allows students to think outside the box. It really pushes them to the limits of the topic, requires them to get information from other students that they might not have in order to answer their own questions. Excellent. Yeah, so we're gonna play a quick little game. Vivian, I think you won this game before, but it's now different questions around topics of health IT. But we're not going to keep any score, but we're going to play questionary. And this is a game where there are no right answers, only right questions. I came up with that on my own. I was very proud. Again, I don't like games. That's okay. We're not keeping score. So what I'm going to do is I'm going to give you a question, and I want you to read the question. And I want you to think about if you were to ask this question to your students in your class. And do you think this would be a good discussion question? Why or why not? Once you have a response, you can just raise your hand or you can just type directly into the chat box why you think this would be a good discussion question or not. Okay, so here we go. Number 1, is this a good discussion question? Why or why not? Yeah, Michelle, it's very broad. It's very vague. Okay, Ken, you said not. Why not? Yeah, Lisa, I'd ask for a definition. So once the students define it, the discussion's over, if they just define it. But as Michelle said, it's a broad topic, so they could define quite a bit. Okay, yep, not a good question to start with. It'll only invite more questions like we've talked about. What aspect of meaningful use are you talking about? The whole thing? Yep, and it's a definition. No, because if one student answers the question, another student can use that definition. Yeah, so it doesn't necessarily allow students to think beyond what they've already heard. So I'm going to ask you guys a little bit more of a challenge question. How would you create, or could you create a discussion question on this very same topic, meaningful use, that would be a better discussion question? And if so, feel free to type in your ideas into the chat box. Margaret, list 2 requirements of meaningful use, stage 1, and explain why you think the government included those requirements. Excellent. So it's asking them to explain why, not just, she goes beyond listing, but then ask for a why. Michelle, how will meaningful use impact you as a patient? Excellent. So that's not only taking a why or how question, which are always great discussion questions, but taking it from a particular perspective as a patient. Amy, how does meaningful use impact patients and or healthcare organizations? So Amy, yeah, the same thing, and then you also took it to the healthcare level as well. Excellent. So Chris, explain how meaningful use is impacting healthcare providers and provide incentive for them to adhere to it. Very good. Yeah, all of these are great discussion questions. I came up with another one just in case you all left me high and dry, but you didn't. Appreciate that. What are the major barriers to meaningful use of EHRs, and what steps might be taken to overcome such barriers? So all of these would be much better discussion questions than what we see here. Okay, let's try it again with this question. Is it a good question? Why or why not? Okay, Michelle says it's too personal. So maybe people don't want to share their experience in a hospital. I actually hadn't thought of that, Michelle. I was actually thinking the opposite, that it was good because it allowed students to relate to their own personal experience. But that's a really good point. Let me just see. Yes, so yeah, with you, Amy, I was thinking, yeah, everyone can relate to it. Vivian, it's too vague. What do we expect to get from the discussion? Irene says, yes, the answers will vary from student to student. Yeah, they'll all have different experiences. Chris thinks it's good. It allows students to relate their experience. Lisa, you think it's not so good. It doesn't promote discussion, just a list. Yeah. Yeah, so it looks like we have some mixed views here. On the one hand, it's good because it allows students to share their own experience. Everyone will have something to say on the topic, and it will be different because it's all their unique experience. On the other hand, some of you mentioned that it's not really generating a discussion. If you notice,
he's not getting audio. I know, I lost it too. I would recommend.
Hey, Amy, I think we can hear you. Are you trying to answer in, Amy?
Like,
oh. Okay. Can everyone still hear me? Amy, are you still able to hear me? Yes. Or Amy, that's Amy Bledsoe. Amy Conchilla, are you still able to hear me? Okay, I think she's trying to redial in again. Okay, great, Amy. Yeah, Ken, you're right. Anybody can, answering the question could hold back personal information if they don't want to share it. So on one hand, it's good for that reason in terms of connecting to the student. But on the other hand, if you look at the second question, it's a yes-no question. So like you mentioned, Lisa, it doesn't really generate discussion. So I want you guys just to type in your chat box, how might you put a twist on this question to make it a better discussion question around the same concept, around technology during the patient-doctor interaction? Feel free to type in other questions. Okay, what type of technology was used? And maybe even piggybacking off of that, how did it change your experience? You could ask what types of technology were used and if any, and if there weren't any used, what type of technology might have been helpful? Okay, great. Michelle, imagine the scenario and explain how tech can support the interaction between nurse and patient. Benefits and limitations, excellent. Consider the use of technology. Do you feel technology was helpful? Great, Lisa. Again, connecting it to the student, but also asking them to go beyond that and evaluate the usefulness of the technology. Yep, Margaret, how did it positively or negatively impact your visit? Yeah, and Amy, how did they use your information electronically? So not just did they, yes or no, but how was it used? Okay, great. All right, so yeah, I think came up with the exact same question that many of you came up with. How did the use of technology affect your experience? Good, okay, let's do one more, a little bit more on the IT side. So this is a how question, which by our quote-unquote rules of discussion questions means it's supposed to be good. But what do you all think? Is this a good discussion question? Why or why not? Okay, Amy thinks so. She's a health IT expert. Okay, Michelle doesn't really get the question, so it's probably not a good question if your students don't understand what it is. Okay, not really a discussion, more of a brainstorm of a definition. Ken, you think it's too technical? Seems more of an essay question. My students wouldn't get the question, so maybe it's not clearly phrased. Okay, we're running a little short on time, so I'm just going to go through and kind of pose another question that might be a little bit more of a discussion question. Describe a scenario where reducing data redundancy would impact healthcare delivery. So the first question was kind of more IT related, and as you said, kind of not clear. This one actually allows students to take the concept of relational databases and data redundancy and apply it to the healthcare environment. Okay, so real quick, since we just have 11 minutes, we're going to talk a little bit about assessment. And I like this cartoon because it just shows how important assessment is. Just because you taught it doesn't mean they've learned it, right? So we're going to look at different types of assessment and just kind of talk about what kind of skills or knowledge you think this particular type of assessment would assess in health IT. So here's an example of an assessment question that was created in our curriculum. And you all know the multiple choice question. It's definitely a go-to on testing. So let me ask you a question. For what types of skills or knowledge are multiple choice assessments useful? Just type into your chat box. Exactly. Terms and definitions, Lisa. So defining terms, identifying properties of a concept, or just basic knowledge of a concept. We'll take a look later on about how to make multiple choice questions assess higher level knowledge and skills, but this one is straight up defining something or the memorization of something, as you mentioned, Chris. There's also short answer questions. So take a look at this question and tell me what types of skills and knowledge are short answer assessments useful? Okay, a little bit more understanding, okay? A deeper level understanding of a concept. So just from moving from just terms and definitions, but yeah, as Lisa mentioned, comparing concepts, explaining them, describing them, or defending a perspective on a concept. Short answer questions are great for that. I'm going to skip this next slide. It just compares a couple short answer questions and move on to how to make multiple choice questions more interesting. So here's your standard multiple choice question around the topic of HIPAA. We talked about that a little bit earlier. And I want you to compare it to the question that follows and tell me which one you think is more engaging for students and why. So here we're covering the exact same concept, but in a little bit of a different way. So which question is more engaging for students? Multiple choice without scenario or with scenario? Okay, Michelle says it's better, the scenario is better, it gets, it's more interesting, gets the imagination going. Great, Margaret. With scenarios, it asks students to actually apply knowledge. Okay, so they're not just, they're applying it to a real situation, not just regurgitating. Okay, Chris, the scenario makes the question more clear. So I didn't even think about that, just to like remove any ambiguity from a question. Excellent. And Vivian, the scenario shows the student how the information is relevant to them. So again, connecting this to real life experiences. Adult learners like relevancy. If it's not relevant, then why learn it? And they can relate better to the question. Excellent. So sometimes you all are forced to use multiple choice because it's easier for grading, it's less resource intensive. But just think about how you can make that multiple choice question more engaging for students through the use of scenario, and even test higher level understanding and skills. So rather than just defining HIPAA, here we're having them apply HIPAA to a specific situation. Great, and here's just an example of a short answer question with a scenario. Just to give you another spin on short answer. But moving on, I want to ask you, because particularly with health IT, which is can be such a hands-on skills-based profession, whether you're using applications in a clinical setting, for health faculty, or whether you're working with those applications through the back end for IT faculty. So in one of our programs, actually, Scott, this comes from Spokane, from the mobile software development program. And how would you assess a skill, for example, like creating a personal health record app? You can just type in your chat box. Would you do this multiple choice, short answer, or is there another way that you might assess such a concrete skill? Okay, hands-on simulation. You could do an actual lab and evaluate them. Margaret says a project. Vivian, the student should actually perform the activity. Yeah, and we all know this can be very resource intensive as faculty. I know that the idea of assessing multiple students in a lab can be a little daunting. So yeah, as Lisa mentioned, depends on how much money you have in your curriculum development budget, exactly.
And Brooke, Brooke, if I could just chime in here, I'd like to let all of you know that we have an educational technologist on our staff for the duration of this grant. Or actually through December 2015. So if any of you are developing health IT activities, or you have an idea for one, but you don't want to spend the hours it takes to develop it in terms of the technology that's required, send it over to us and we'll develop it for you.
Yeah, thanks. And Roger's great. He's worked a lot with Vivian and some other faculty on our staff. His name's Roger Adams, and Lisa, we can send you the contact information for him. He's also an instructor in the course. Okay, so yeah, as you guys mentioned, lab simulations, labs, or project-based assessment. So here is an example of a phone gap project, and all you IT people out there, especially you, Scott, know what this is way better than I do. But real quick, Spokane developed a project to assess students' ability to create a website, essentially, a health website, and then convert it into an application that you could use on a smartphone or an iPad or a mobile device. And Scott, please correct me if I'm totally butchering this project, but this is what I understood from reading it. And he outlines the specifications. This is just the categories. I didn't get into detail here, but what required content it needed, what type of functionality, testing, publishing, how to publish it. And then, of course, very detailed, this is just a section of it, a very detailed grading rubric to grade the project. So that's something else you might want to consider for assessment, particularly in the field of health IT, where a lot of it is very concrete skills-based. I don't think, Margaret, we have time to go through scenarios. So I'm going to wrap up a little bit on assessment. So just make sure the assessment fits the learning objective. If it's a more defined kind of learning objective, maybe multiple choice is appropriate. If it's explain, maybe short answer would be more appropriate. Create might be more for a project or a lab. Where possible, try to make the assessments reflect a real-life situation. So that's where scenarios come in. Tie it to the work environment, not just regurgitating information that they've read or listened to in a lecture. Provide feedback where possible. So we saw real quick, on this assessment question, we saw feedback for a correct and incorrect answer. And it's not only feedback that it's, you know, yes, this is correct, or yes, this is incorrect, but it explains why it's correct or why it's incorrect. And that's what we're calling formative feedback. And then include rubrics or checklists if needed for a short answer and project-based assessment. Sorry, we have to skip through.
I'm afraid, yeah, we're going to have to move right on to the last slide.
Moving on. So maybe this will be for the next scenario, you guys, or the next webinar, you guys will get to learn a little bit more about how to create scenarios in health IT and see some examples. But what we'd like you all to do for our next webinar, which is November 19th at 12 p.m., if you could just think of a health IT related activity, or hook question or discussion question or assessment that you've either used in your course or that you would like to use in your courses, and bring it with you to the next webinar and be prepared to share. We would love to get y'all's ideas on this since you are the subject matter experts and actually in the classroom.
So we'll be looking for one item from each of you for next time around. And then, Brooke, if you wouldn't mind switching to the next slide.
Yep. I'll just pass the controls over to you.
Okay, great. So this is what we were looking at for next time around, and just wanted to get your thoughts on it to see what this sounded like. We thought we would do some training on how to use webinar to teach health IT topics. Webinar is a training tool, and hopefully we won't have any audio glitches next time around. And your presentations of health IT instructional items that you've created, and some additional information about EMR Star, plus a brief virtual tour of Open EMR and some of the exercises that have been created, and then a tour of some of the health IT resources that are available out there and how to access them. Resources, national resources that are open source, how we've organized activities and assessments that have been created as part of this grant, and materials that were created as part of our previous grant. Does that sound like it would serve you? Are there other things that you would rather see on the agenda for next time around? If you think of something over the next week or so, just feel free to drop me an email. And thank you so much for your active participation and all of the comments, and for being gracious with all of the technology challenges we had today. Thanks so much. Have a good afternoon, or our friends in Northern Virginia, a good evening.
Thank you.